Growth hormone deficiency is a medical condition that affects a wide variety of bodily functions. It is caused by problems in the pituitary gland in which it does not produce the sufficient amount of growth hormone in the body, thus causing the body to have short limbs or a syndrome called dwarfism. HgH deficiency has different effects depending on a person's age. For example, in a newborn infant, the primary appearance may be hypoglycemia or perhaps microcephalus, while as they get older, growth failure may be the primary noticeable symptom. There are two primary forms of human growth hormone deficiency: primary HgH deficiency and secondary HgH deficiency. Most patients that are born with human growth hormone deficiency and need treatment throughout childhood and adolescence have primary HgH deficiency, in which their pituitary gland does not have the ability to produce adequate amounts of growth hormone for normal growth. Most adults suffer from secondary HgH deficiency, a condition in which the hypothalamus does not signal appropriately for the production of growth hormone by the pituitary gland, which leads to symptoms of deficiency. Most adults experience age-related HgH deficiency as a result of a slow decline in hormone production, rather than an abrupt change in hormone balance. The symptoms of HgH deficiency in adults and young children are different. For children, the most common symptom in growth deficiency is the slow improvement of height, where the child grows less than 2 inches a year. For infants, slow muscular development can cause delay in motor skills development such as jumping, walking, and standing. However, there are several other signs of a child with growth deficiency, such as their height is shorter than the average for their age and sex group, which can be easily recognized by regular checkups and measurements that can be done at home. Another sign is an increase of fat around the child's waist and face, making the child look younger than his or her actual age, as well as when compared to other children in the same age group. Also, a delay in puberty and teeth development. In children, HgH deficiency is quite easy to diagnose, but in adults, it is more difficult, because the symptoms of human growth hormone deficiency share many symptoms with other conditions, such as testosterone deficiency and chronic fatigue. Physicians generally provide a preliminary diagnosis of HgH deficiency based on the accumulation of symptoms associated with the condition. These symptoms may include low energy levels, decrease in strength and toleration of exercise, rapid weight gain, loss of muscle mass, and thin, dry skin. People who have growth hormone deficiency can also feel psychological symptoms, including anxiety and depression. Many patients mistake HgH deficiency for simple aging because of how slowly the symptoms manifest themselves. With age-related HgH deficiency, symptoms occur slowly, thus making it harder for people to identify during its early stages. Growth hormones are particularly significant, especially during youth, because they aid in the development of growth in the body. In adults, growth hormones maintain muscle mass in the body, maintain the proper level of fat utilization in the body, and bone density. Low level of growth hormones in adults can cause severe emotional problems and can also affect their physical health. When a symptom of growth deficiency is already seen, never hesitate to seek help from experts in order to avoid it worsening. In children, HgH deficiency should be treated promptly in order to promote the normal health and development of the child. In adults, HgH deficiency is not as widely treated and the symptoms are not so obvious, but patients can benefit greatly from acquiring treatment. In order to learn more about the symptoms of HgH deficiency and learn the different ways of treating it, just fill out the contact form on our website, which you can access by clicking the link below in the description. When you fill out this contact form, you can schedule an appointment with a doctor that is an expert in the field of endocrinology. Symptoms should be taken seriously while it is still at the early stage of development. We offer hormone replacement therapy services to patients over the age of 30 all across the United States. To get started with your own co-created HgH, testosterone, sermorelin, or HCG therapy program, please fill out the contact form on our website. Don't make the mistake of mistaking your HgH deficiency symptoms as simply the inevitable degradation of aging. Contact a medical professional that can provide the diagnostic testing necessary to determine if hormone replacement therapy can relieve your age-related health issues. Thank you for watching.